President Tinubu has appointed new heads of agencies and programs under the Ministry of Humanitarian Affairs, Disaster Management and Social Development to facilitate the needed relief to Nigerians and ensure the effectiveness of humanitarian and social development programs. As the new appointees take office, analysts say this is a time to effect a positive change in the government's humanitarian programs.
Right, for an appraisal of how the private sector has been carrying out its humanitarian intervention and what lessons the government can learn, we're now joined from our Lagos studio by Youssoufu, the Managing Director and Chief Executive Officer, Dango Foundation. Thank you for joining us on Newsnight tonight. Well, I mean, it would be nice to first off, help us understand what the vision of Dango Foundation is and how it's been able to close the gap in terms of, inequalities in the system, especially with the biting economic crunch.
So thank you very much for having me this evening. So the Aliko Dangote Foundation has been around for 30 years. We actually just celebrated the incorporation of the foundation this past May. And so for the past 30 years, Alhaji Aliko has really focused on helping the most vulnerable. This year, and just to give you a little bit of, a little more information about what we do, we focus on 3 areas: health, education, and economic empowerment. And so we also have our humanitarian program that we run whenever there's a crisis. And so this year, as part of our regular Ramadan feeding, we've done it for the past, many 30 plus years. But this year, just because the hardship was so extraordinary, Alhaji Aliko said that we should reach out to everybody in the country, the most vulnerable in our country, and that's what we did. So we distributed 1 million bags of rice across the country. So I think what you wanted to understand is how did we do it, right? How were we able to make sure that our rice got to the most... Mm-hmm.
Not just your rice, your welfare.
Sorry, there's a bit of an echo.
Yeah, your welfare interventions in general and how you're able to, close the gap, especially for the most vulnerable in society.
Mm-hmm. Mm-hmm. So I'm going to give you the specific example of the rice because I think it's a really good illustration of how we work, right? And so, once we had the target of 1 million bags that were to be distributed across the country, first we had to get the 1 million bags of 10 kg rice, right? And if you remember, back in March, the price of rice was really rising. And so even being able to put our hands on, enough bags was a challenge. So we had to make the bags, we had to source the bags with 13 vendors across the country. And then the real work was distributing the rice, which was done in partnership with different organizations that were deeply rooted in all the communities we were going into. So it took us a while to identify all, imagine going, through all 36 states plus FCT at once, right? It's not like doing something in one state, so we have time to, really, take our time and do this. Alhaji really wanted us to distribute it within a very tight time frame. So we spent a lot of time identifying the best NGOs that had the best reputations, that were vetted, and that were actually in the community. We work with faith-based organizations. So in the north, we work with Hizbah. In some of the southern states, we work with the Catholic Church and various different churches and different civil society organizations. And what we did was make sure that those organizations had their tentacles into the community. Because with us, with our 3 offices in Lagos, Abuja, and Kano, there's no way that we would know, what would be going on in Abia or in Kebbi, right? And so we needed those local organizations to help us. And so we partnered with them. We paid them the logistics fee to do this distribution for us. And then we had our staff oversee what was going on. And also because we were doing this across all the states at the same time, we wrote to all the governors and told them what we were trying to do. We asked them to give us a team, one of their teams, to come and witness the distribution and make sure we were doing the right thing. And all of them did. Some of them even helped us with logistics and security. And so I think the key was really working with the local organizations, because we are very clear on where we don't have access, right? So when you deal with organizations that work on a day-to-day basis with the most vulnerable, then you can be sure that they know who their constituents are and they know how to get them. And we, of course, followed every single bag with somebody from the foundation. Some of our business units, like the commercial side of our company, also helped us. So some of our colleagues in cement, rice, sugar in different states also helped make sure that the rice went to the right people.
Okay,
So I think the key was just to work with local organizations directly.
Let me comment here. Now we're talking about the most vulnerable. The first question, because a lot of people are still trying to, unravel the expertise in identifying the most vulnerable in our society and how best you can get these palliatives to them. Identifying them has always been a problem. Perhaps you want to share how the foundation has been able to go around that task.
Mm-hmm. So I think it's also important that we understand that we actually know who the vulnerable people are. Like if you go to every local government area, the needy and the vulnerable are obvious, right? They're the ones who have been recipients of a lot of support. And even if you ask either the community itself or community leaders, they're very aware of who the most vulnerable are. It's either people with disabilities, it's people who, widows. Those are the obviously identifiable ones, but a lot of families are struggling, and the ones that are struggling the most are very easily identified by their neighbors and by the community. So that's why this is not something that you can do from afar. It has to be close to that particular community. I'll tell you, for instance, in Kano, where we work with HISBA, they had the list of the most vulnerable families in all of the LGAs in Kano, and there's 44 of them. And when we went to do this distribution, they had lists, they had very clear indications of who these people were. We took samples, we understood, we called, and those people were the ones that had really been identified. And so I think the difficulty is, letting go and trusting the community itself. I think when we try to hold on to control, it won't work. The other thing that's really important is we looked at the multidimensional poverty index that was done by the National Bureau of Statistics. So they did surveys, I think it was, the report came out in 2022. And so because there's different aspects of poverty, right, whether it's, education, access to sanitation, access to education, to health, et cetera, even as those surveys are being filled, it's very clear where the most vulnerable people are. And so I don't think it's as challenging as sometimes it's made out to be, how to identify people.
Well, that's quite interesting to note, because one question that continues to be on the lips of Nigerians is, look, do you have data? How do you ensure that whether it's a private organization like yours, that's giving out palliatives, or the government, how do you really ensure? Do you have feedback, some kind of feedback mechanism to ensure, to give you confidence that your rice or whatever you're giving out, to these vulnerable groups actually does get to them? And secondly, are there more sustainable ways that your foundation is stepping in to help the vulnerable population, like building health centers, roads and things like that, beyond giving out palliatives?
Mm-hmm. So palliatives are just that, right? To literally bring relief temporarily. It's not a solution to hunger. It's not a end result. It's a temporary solution to a problem. And when people are really hungry and struggling, I think a gesture just to encourage people and to give them something is really important. And not only is it symbolic, but it's also helpful literally for them. What I was going to say about our feedback loop. So once we've, agreed with the organization, let's say we're working through a church in Enugu, we go with them, we witness the distribution, and then we go back and check to see, whether the rice has gotten to the very last mile. Because imagine when we, bring the bags, let's say there's 40,000 bags that are allocated to a state. They go to a warehouse, which usually we would manage the warehouse, and then working together with the organization that's going to do the distribution, we now take the food from the warehouse to the distribution point. And so we can see at the end of the distribution, we get a report from the NGO that did the distribution for us, identifying all the people. So we have pages and pages and pages and pages of reports with names, phone numbers, identifying the people who had received our goods. So that's how we make sure that the food gets to the most vulnerable.
Interesting.
In terms of a more sustainable solution.
We're almost running out of time, and so that I have to bring this in quickly here because learning curves are very important here, knowing full well that we have other agencies watching. Are there challenges, and if there are, how were you able to navigate them?
So of course, there's always going to be challenges because, if we've picked, the 1,000 most vulnerable in a community, well, the 1,010 family feels left out. So there's always going to be somebody who doesn't get, because there's absolutely no way, like 1 million bags, if you think about it, it's a lot of bags. It's 15 billion naira that we spent. But if you really look at it, like we're never going to be able to give to every single needy person. So part of the challenge is, like we had just discussed, making sure that the most needy really get it. The second challenge is to make sure that there's not this overwhelming situation where people rush the distribution point. So to do it in an orderly manner and making sure that nobody gets hurt and that there's no, I don't know how we say it in English, overwhelming the system that would happen with the needy people. So it's never going to be perfect because we're talking about, not enough of a commodity in a context where people need more of what we're bringing. So obviously, there's always going to be somebody who's dissatisfied, somebody who didn't get what they needed. But at the end of the day, what we feel good about is that we tried, that we did something that people appreciated, and that I would say 95% of the rice that we gave out, of the bread that we give out every day, of the feeding program that we run in Kano, of the palliatives that we give out on a regular basis, 95% at a minimum of it really gets to who we intended for them to get. So that's what we have to live with.
Yeah.
Well, Zuret, we'd like to thank you for your time. Thank you for speaking with us here on Newsline today.